Hi. So what is Pap test? Pap smear test or the Pap test is a cervical screening procedure. So when do we do this? Ideally, we do this when a woman does not have her periods or when she does not have a vaginal bleeding. So whom do we advise this Pap test? We usually ask them to get this Pap smear test every year after the age of 21. And if less than 30 years, if the person who is sexually active, the previous Pap smear test every year which was done was normal, consecutive 3 years, then we ask them to get it at least once in 3 years. So if the woman has already reached around 65 to 70 years and after which she is not sexually active, and if the previous 3 years of pap smear screening have been negative or normal, then she can stop screening pap smear test. Then also, if the patient has any other high risk for cervical malignancies, then we may call them often for a pap test. So what are the do's and don'ts in pap test? Prior to the pap test, we usually avoid sexual intercourse in the previous 24 to 36 hours. We avoid any use of vaginal creams or jellies. Also, douching should not be done. So what exactly happens during this pap test? So when you go to a doctor, the doctor will ask you to use the washroom, empty the bladder and come to the cabin. Then in there, they'll give you a hospital gown to change. Then you'll have to lie down on the patient's cot in a dorsal position. Then a speculum is inserted into your vagina and at the level of the cervix, the external os, with the help of a cyto brush, the sample is taken and which is sent to the lab. Here the lab processes it and they will give you the results in a couple of days. So the results can be either varied from abnormal cells, normal cells, infection, inflammation, or even malignant cells can be seen. So if there is any infection or inflammation, we can treat the same. If it's a pre-malignant, then we can treat it accordingly. If it's malignancy, you know what to do. Please see your doctor. So what can you expect after your pap test? After your pap test, some people can have a slight pain near the vagina. Some people can even have little spotting or a fresh bleeding. So if you have any further concerns regarding your pap smear test, you can always contact us. Thank you.